Hello, everyone, and welcome to today's broadcast, Association of Biotin Ingestion with Performance of Hormone and Nonhormone Assays in Healthy Adults, presented by Dr. Danni Li, Director of Clinical Chemistry and Assistant Professor of Laboratory Medicine and Pathology, University of Minnesota. I am Xavier Gutierrez of LabRoots, and I will be your moderator for today's event. Today's educational web seminar is brought to you by LabRoots and sponsored by Diasorin. For more information on our sponsor, please visit www.diasorin.com. Now let's get started. Before we begin, I would like to remind everyone that this event is interactive. We encourage you to participate by submitting as many questions as you want, at any time you want, during the presentation. To do so, simply type them into the Ask a Question box and click on the Send button. We'll answer as many questions as we have time for at the end of the presentation. Also, please notice that you will be viewing the presentation in the slide window. To enlarge the window, click on the arrows at the top right-hand corner of the slide window. If you have trouble seeing or hearing the presentation, click on the Support tab found at the top right of the presentation window, or report your problem by clicking on the Answer a Question box located on the far left of your screen. This presentation is educational and thus offers continuing education credits. Please click on the Continuing Education Credits tab located at the top right of the presentation window and follow the process to obtain your credits. I'd like to now introduce our presenter, Dr. Li. You may begin your presentation.
Thank you for the nice introduction. Today, I would like to talk about biotin ingestion and interfere with lab tests. For disclosure, I received research funding from NIH, Alzheimer's Association, and CDC. And I also received speaking auditorium from Abbott's Diagnostics, Diasorin, and consulting fee from Roche Diagnostics. So the objectives of my talk are listed here. So the primary objective is to review mechanisms and factors that determine high-dose biotin interference with lab tests. And I would like to use two of my publications to talk about this first objective. And then second, that I like to describe this increasing trend of high-dose biotin use and the health and medical benefits. And then thirdly, I like to explain that how this continuing trend that may be a game changer of the clinical diagnostic industry. And lastly, I want to make a case for why more research is needed to understand the nutritional and therapeutic value of biotin. So the background story of this talk, and some of you may already know, is that in November 2017, FDA issued a warning concerning biotin interference with lab tests. This is because that many of the lab tests that are immunoassay that exploit the binding between biotin and strobilurin. So what is biotin? Well, biotin is actually known as a vitamin B7. Also, people know biotin in terms of its strong binding to strobilurin, and this strong binding is actually utilized in many automated immunoassay platforms to improve assay performance. So here is just a list of the major diagnostic instruments that used in our clinical lab that use biotin and strobilurin binding. And I will talk about the mechanism and of how biotin interfere with those assays on those instruments later. So you may wonder, okay, so the story is that biotin, when you take high dose, that would interfere with lab tests. And so what about the natural level of biotin in blood? So natural blood level of biotin is actually very low, and they're at the range of nanogram per ml that usually that is too low to cause any interference. However, that recently that there's a trend of taking very high dose of biotin for health and medical reasons. For those biotin known as supervitamin, and people taking it in a very large quantity, such as 5, 10, even 20 milligram daily for help with their nail and hair growth and for other reasons. So and in addition to those health and beauty and cosmetic reasons, that there are also therapeutic reasons that why people are taking large doses of biotin, such as for treatments of biotin deficiency, for diabetic neuropathy, and also there's phase 3 clinical trials that of using biotin at a daily dose of 300 milligram for treatment of multiple sclerosis. So there's a lot of reasons why people take biotin, and now at very large dose. So the question is that can high dose biotin screw up lab test results, and if so, how? Because so far we talk about biotin is an important component that in many of those immunoassay tests that use in the clinical lab. And historically, that because there's no use of large dose of biotin, therefore the natural level of biotin, which is very low in the blood, is not going to cause any interference. However, there's a recent trend of using large dose of biotin that due to medical and health reasons. And so that this new trend is whether it's going to cause the lab test interference. So the answer of this question is yes. And we're going to actually demonstrate this, that using this case that I published in 2009. So this is a case of 64-year-old female with long-standing end-stage renal disease. And she came to the hospital for evaluation of her renal osteodystrophy, was particularly concerned for Adynamic bone disease. So she was in the hospital and was seen by endocrinologist, who is trying to figure out whether she has either renal osteodystrophy or Adynamic bone disease, which has very different presentation in terms of the lab test. Particularly the lab test that would be helpful in evaluating her would be PTH, parathyroid hormone, and alkaline phosphatase. So for differential diagnosis, if she had renal osteodystrophy, her PTH and alkaline phosphatase were both going to be elevated. On the other hand, if she had Adynamic bone disease, her PTH and alkaline phosphatase will be both, decreased. So what actually was then discrepant in her case, and also the reason that her endocrinologist contacted the lab, is that in her case, the PTH was decreased, but alkaline phosphatase was increased. So this scenario that was inconsistent with either picture. So long story short, that the lab helped the endocrinologist with investigation. So we first that actually looked at the medical chart and realizing that the patient has been taking large dose of biotin, 10 milligram daily, for treatment of her restless leg syndrome. And so knowing that biotin could be interfere with this test of PTH, so we performed a lot of lab investigation, but in order to confirm this, we did ask the patient and stop taking biotin for 2 weeks. And after 2 weeks, the patient came back, and now the PTH results has gone up. So now the picture of PTH is actually consistent with the elevated alkaline phosphatase. So here I don't have time to go into a lot of detail of the investigation, but to say that this was actually the first case that published in United States that demonstrating the biotin intake interfere with lab test. In this case, that the lab test involved was the parathyroid hormone test. So you may want to know, okay, so what is then the mechanisms of biotin interference? So this slide actually shows you the mechanism. So as I mentioned before, that many of those automated immunoassay platforms that take advantage of the strong binding between strobilurin and biotin. So many of those systems that use strobilurin-coated magnetic beads to capture biotinylated immunocomplex of interest, in this case, PTH. So imagine that when you have excessive amount of biotin present in a blood sample as a result of taking a very large dose of biotin, that those excessive amount of biotin that would actually compete binding to those beads. And as a result of that competition, there was less of those analyte of interest that will ended up binding with the magnetic beads. And then this reduction of binding then results as decreased assay signal. So depending on the depending on the immunoassay design, the decreased assay signal either cause false decreased results in the sandwiched immunoassay or falsely increase the results in competitive immunoassay because the relationship between the analyte concentration and then the readout. So in this case, that PTH is measured by a sandwich immunoassay, and therefore the excessive biotin presence in the sample will cause falsely low PTH result, which is consistent with what we saw in the case. So far that I have actually met using this case that I published to demonstrate the biotin interference and then the mechanisms, and then also the direction of interference when it happens to sandwich immunoassays as well as competitive immunoassay. So the next question is then, so how many of the clinical tests are actually affected in healthy adults when take large dose of biotin? Well, so in order to answer this question, that we actually designed a study But before I talk about this study, I want to take a step back and then just to think about this question. So we talk about that there's many clinical tests that utilizing biotin and strobilurin, right? So we also know that it's possible not all the tests that utilizing biotin and strobilurin would be affected, and the impact that may depending on many different factors. So this study is really designed to answer the question that when an individual that take a large dose of biotin, how many tests are actually affected by the amount of biotin present in the blood. So in order to do this study, that we recruited about 7 healthy adults that we asked them to take biotin for 7 days, and then stop taking biotin for 7 days. And for each participant that we take their blood sample from baseline 7 days after taking biotins, and then 7 days after stop taking biotin. So each participant, we have 3 blood samples collected. Also, we want to evaluate at as many tests that possible. So in this case, that we reached out to many different clinical labs. That so altogether in this study, we evaluated 11 tests measured by 37 assays over 4 diagnostic systems. And so here is the summary of the study results. 23 of those assays are prone to biotin interference. So what that means is that those were the assays that actually did use biotin and strobilurin as part of their mechanisms. We found that in this study, about 9 of them were actually affected by the biotin ingestion of 10 milligrams daily. And also, as part of the control, we included 14 assays that are not prone to biotin interference, meaning that those are the assays that do not including biotin binding to strobilurin as part of the mechanism. And then, as expected, none of the assay was actually affected. So now let's go over to actual of those tests that we evaluated in this study. So first we actually included 5 of those thyroid function tests that has been shown in literature that they are most likely to be affected by biotin interference. So in this case, that we included 4 different diagnostic systems: Cobas, Vitros, and Vista, and Abbott. So the result here shows that for TSH, Cobas and Vitros are actually when people taking biotin, their TSH level will drop significantly. So particularly in the Vitros case, that the TH level was significantly decreased. And then we also show that when healthy individuals take 10 milligram daily dose of biotin, that their total T3, free T4, and free T3 could also give false result. But in contrast with TSH, which this signal is decreased, for the competitive assays such as total T3, free T4, or free T3, the actual impact is falsely increased results. So this slide basically summarize that when healthy individuals take 10 milligram daily dose of biotin, and their blood samples when assayed by thyroid function test, that can give results that lead to false increase or false decrease results. That is actually problematic. And then other tests that we evaluate in this test, that including parathyroid hormone and NT-proBNP and vitamin D. So again, here shows that when healthy individuals take 10 milligram dose of biotin, that if they have a PTH test done by vitros instrument, that they actually this will actually lead to falsely low results. Same thing for vitros NT-proBNP. For vitamin D, that we see here that the biotin actually would interfere with COVA's vitamin D assay. So the study that, we evaluated many different systems and many different tests. So from those two previous slides that you can see that some tests are more prone to biotin interference than other tests. So in addition to the test diagnostic system, so two additional factors that may also determine that biotin interference with, is the dose of biotin that an individual is using, as well as the timing of the last dose. So this slide actually explains why the biotin dose matter. Well, this is because the higher dose of biotin that people use, the higher biotin level will be present, in their blood sample, and therefore cause more, interference. So therefore, that there's a positive correlation between biotin dose as well as biotin, interference. And also, the timing matters, because this figure shows that the level of biotin in blood post-dose. That so this slide shows that the peak level of biotin reached at about 2 hours after the biotin intake, and then gradually decrease as time goes on. So that means that if a sample is taken at the peak time when biotin level reached at blood, that this is going to cause the most interference. However, that if the biotin, if the blood sample is taking hours, and let's say 24 hours after the initial dose, then the chance of the sample that have interference is much lower. So therefore, the timing of the last biotin dose also would actually affecting the actual biotin interference. So given all this information, so what are the manufacturer what could the manufacturer do? The manufacturer that who produced those tests, that has been very active in terms of publishing information and working on recommendations, so that that more people are going to be aware of this situation. So particularly, they are working on recommending the blood sample, the safety testing of blood sample. They trying to figure out how long a blood sample should wait before it's taken from an individual person after their last dose of biotin, in order to limit the chance of biotin interference. So I hope that, so far that you would agree that high dose of biotin use can interfere with lab results. And I have, go over the mechanism, and also I have, using my recent study to demonstrate that the extent of the problem, as well as the factors that will impact the interference. So then the next question is, why is this important? Why does this matter? Well, the number one reason why it matters is that, as you already kind of seen, that many of those clinical immunoassays that use biotin and stromatopin interference, therefore that a significant amount of them are prone to biotin interference. So another reason that I haven't covered is that actually there's an increasing trend of large dose of biotin supplement use. Even though we don't really have the prevalence and longitudinal prevalence data, however, that this trend is in part that reflected by the number of case reports that published in literature over time. So over the last 10 and 20 years, there is an increasing trend of case reports that starting from 1996, there's only one case till recently. There's about 7 cases that published in 2017. So this increasing trend of case report that as it's reflecting that the increasing trend of biotin use that we have seen. So then the next question that I think would be important to for the diagnostic industry to consider is that is this trend of continuing use of very large dose of biotin that going to have some sort of impact on the diagnostic industry? Well, if there's one test that is going to be very critical, and that test would be the troponin. So for many of you that in the lab medicine community, that we know that troponin is a test that providing critical information for evaluating heart attack. So and in the recent FDA safety communication that I mentioned very early on in the talk, that FDA actually singled out troponin as the test that, and particularly this communication mentioned that FDA received a report that a patient taking high level of biotin died following a false low troponin test, when troponin test is known to have biotin interference. So, this demonstrating that, it's very critical that for patients that, especially when they have a troponin test, performed, that we need to know whether they have, interference such as troponin, whether they cause interference, because this test providing such critical information for evaluating patients. So, so how much do we know actually that the potential of this test that would cause trouble in the emergency department, where that most of those troponin tests were performed? So here recently there's a very nice actually paper published by Katzman from Mayo Clinic that demonstrated that biotin supplement use in patients that presented to the emergency department. So in this study, they evaluated, this question in two different ways by using survey questionnaires as well as the biochemical measurements of biotin concentration present in samples. So both methods that demonstrated that there's about 7% of people through survey that indicated their use of biotin. And then also there's about 7.4% of those sample that has biotin level that measured at or above 10 nanogram per mil that's known to interfere with some of the Roche immunoassays. So this study complemented with the FDA safety communication that illustrate that biotin interfere with lab tests, and particularly with troponin tests that could be an issue in the ED departments. And so to answer that question, say, if there's any test that could, be, impactful so that the manufacturer would consider change, how the method to, prevent biotin interference, therefore, then this would be the test that will change the scenario. So I think that from what I've had talked before, the point that is, okay, so we now seen there's a trend of biotin use, and the trend is increased, and the trend is increasing the way that about 7% of the people presented to the ED department that use biotin, and there's about 7% of the sample assayed in the ED department that could have biotin interference that change the lab results. So this may have some impact to the diagnostic industry. So then many of you may want to know, so is this trend is going to continue? Like, in order to answer that question, I think a different way to look at this question is there really a health and medical benefit of using biotin? And why do people, taking those large doses of biotin? Well, so the mechanisms that biotin actually could, convey health benefits are really unknown. Historically, we know that biotin are cofactors of many enzymes that are important in mitochondria. So the assumption is that taking large dose of biotin can potentially boost energy production. And so that is good that will give a lot of health benefit. However, that's really, there's not a clinical study that actually given proven value of the medical or health benefit of biotin. So more research is needed. In particularly that more research is really needed to understand that whether taking biotin would actually give people better health and hair growth and nail growth. Despite that, there's lack of those evidence that still there's some studies shows that 66% of the dermatologists that would recommend dietary supplements, including biotin, to their patient to improve their skin health, hair, and nail. And also, this is not only limited in the United States, but in other countries such as Saudi Arabia, like 60% of the dermatologists also recommended treating hair loss with vitamins, including biotin. So, despite lack of evidence that doctors recommend supplement use, so I suspect that the trend is going to continue. So my, recommendation to the science community is that we really need to understand more about the evidence and gather evidence to demonstrate whether there's any health benefits or medical reasons that taking larger dose of biotin. So with that, I like to summarize this webinar. So I hope that I have demonstrated to you that biotin, when taking very large dose, that can interfere with many lab tests. And there's 3 different factors that will determine whether tests are actually affected by biotin interference or not. And the manufacturers are actually working on safety testing recommendation to improve their assay design to limit biotin interference. And then despite the perceived beauty reasons that we need to know more about the nutritional and therapeutic value of biotin supplementation. With that, I'd like to thank my collaborators for my studies at University of Minnesota, Fairview Medical Center, Boston Medical Center, Children's Mercy Hospital, Kansas City, and Johns Hopkins Medical Institution. Thank you for your attention.
Thank you, Dr. Li, for your informative presentation. We will now start the Q&A portion of the webinar. If you have a question you'd like to ask, please do so now. Just click on the Ask a Question box located on the far left of your screen. We'll answer as many of your questions as we have time for. Now let's get started. Our first question is, what should a lab do when asked to investigate a potential biotin interference?
So, so when lab is asked to investigate a potential biotin interference, I didn't have time to go into the detail because it's not the main focus of this webinar. So it's investigating biotin interference is like investigating any other interference. The first step is to identify whether the interference is present or not. So there's a couple ways to do it by, say, send the sample to test by a different methodology, or perform dilution on the sample to see that whether the diluted results and the neat results were still comparable. So if there's no evidence of interference, that basically end the investigation there. But if there's discrepancy in results in such way that it's like so then in order to identify whether biotin is the cause of the interference, is number one, that making sure that patient indeed take biotin, and then number two, that you can patient stop taking biotin, and then see whether the result change in the direction that would be more consistent with patient clinical picture. And lastly, if you have strobavitine magnetic beads or strobavitine beads that in the lab, you could actually treat the sample using the strobavitine beads to remove those excessive amount of biotin, presumably that present in the sample, and then reassay the sample after the pretreatment and removal of those beads, and see whether that sample will gives you the result that is consistent with what was consistent without the biotin interference. So that is a way that then also to help with identify that biotin indeed was the cause of interference. So to summarize that, first is to identify interference is present or not, and then is to identify whether biotin is the cause of interference, that by asking patient to stop taking it or using the beads for treatment, and then to confirm that biotin, by removal of the biotin, that you get the correct answer.
We're gonna have time for one more question. What would you suggest emergency doctors do to prevent misinterpretation of troponin results due to biotin interference?
Well, that's a very challenging question. When let's say imagine a patient that do take large dose biotin and present to the emergency room with heart attack, the blood is drawn for evaluation of troponin, and there's a chance that the biotin interference will cause falsely low troponin results. But the question is, would the ED doctor know about it? Well, so my suggestion that for ED doctors, is to is to ask patient whether they take large dose of biotin, and then if so, that then they know that there's higher chance that biotin that could interfere with the test, and therefore that consider other ways to investigating whether a patient has a heart attack, and also use serial monitor of the troponin level. And then thirdly is that if they have some other ways to looking at troponin using a different method, that is not prone to biotin interference, that maybe they should also look at a different method. So for example, at my hospital, the ED lab, that the ED actually department has access to central lab test, which is prone to biotin interference, and then ISTAT, which is not. So, when you have access to different method, that is helpful to providing information that is hopefully pointed out the right direction.
Well, thank you again, Dr. Li. Do you have any final comments for our audience?
I really appreciate the opportunity to to tell you about this issue of biotin ingestion and interfere with lab tests, and then feel free to ask me questions. Thank you.
Okay. Before we go, I would like to thank the audience for joining us today and for their interesting questions. Questions we did not have time for today will be addressed by the speaker via the contact information you provided at the time of registration. We would like to thank LabRoots and our sponsor DiaSorin for underwriting today's educational webcast. Don't forget to take a moment to visit our virtual lab and virtual booth to find out more about DiaSorin's products and instruments. All of our content is available 24/7, including this webinar, until June 25th of 2019. LabRoots will alert you via email when it's available for replay. We encourage you to share that email with your colleagues who may have missed today's event. Until next time, goodbye.